Younger kids in the class, younger mean the kids who are born either in May, June, July during the summertime, as compared to kids who are born either in fall or in the winter or springtime. So the kids who are born in summer time may, because of their younger age, they may act immature, they may seem inattentive, they may seem hyperactive, they may seem having difficulty paying attention, following direction, as compared to their peers who are born in fall, winter, early spring. So it's important as a physician, as a pediatrician, as a child psychiatrist to make sure the symptoms that the teachers are reporting, the child is unable to pay attention, unable to focus, unable to follow direction, making careless mistakes, losing stuff, seeing immature, difficulty sitting still, those are relatively because of their younger age as compared to the peers, or they actually are struggling with the ADHD symptoms. So it's important for as a clinician to keep that age in mind and pay special attention when we are diagnosing with ADHD, because we don't want to overdiagnose and overtreat these symptoms.